Hi guys. Hi Priya. Thank you so much for joining me.
Hey, Anne. It's such a pleasure to be here with you today.
Oh. So guys, if you're joining us live, welcome. It's really great to have you. We're here to have a conversation with you, so please join in with us, chat with us, ask any questions or share your experiences. We're going to be talking about applied anatomy, and it's quite an awesome topic for Priya and I to be chatting about because we both really love anatomy and we've both created these awesome learning resources within the sphere of canine anatomy. So we'll talk more about that today. But overall, this is just going to be so much fun. So if you guys are anatomy buffs like us, welcome. It's super good to have you. If you're joining us live, please say hi. Let us know where in the world you're from. As you guys can hear, I am a little bit sick, so please be patient. I might have to mute myself a couple of times to just cough and clear my throat, but hopefully my voice will hold up for the duration of our conversation. All right, so if you guys are joining us live, let us know where you're from. Say hi. We're here to chat with you. Priya, will you please introduce yourself and let us know where your love for anatomy comes from?
Hey, everybody. Such a pleasure to be here. I'm such a big fan of online pet health, and it's an absolute honor to be able to share this space and time with you, Anne. So, my background is that I'm a veterinarian. I studied in Melbourne. And currently, though, I own my own business. I run my own rehab practice in Singapore. So it's been quite a journey getting, from a very conventional veterinary practice style career to then coming out of the norm and discovering what is it that I really like and stumbling upon rehabilitation physiotherapy and then going like, oh my god, actually I do love anatomy. This is so crazy because it's one of the subjects that I totally hated in vet school. It was so dry. I don't know if that's your experience as well, Anne. Um,
My experience with anatomy as a student is it's overwhelming. I don't know how anybody takes that as a first year subject and doesn't just die, honestly. It is so overwhelming.
Yeah, I know. And especially when it's like something so new, like we
Yeah.
never, I mean, yes, we love pets and stuff, but we've never really like learned about muscles, tendons, ligaments, arteries, veins. And you're here dissecting this dog and going, how the hell am I supposed to remember all of this? So yeah, I
And
didn't.
as well, a completely different language, right?
Yes, yes, exactly. And knowing the origins, the insertions, and they don't even cover like, you know, the the fascia as well, right? It's like there's so many aspects to anatomy that they just don't cover. And knowing what is relevant to me as a practitioner, as a clinical practitioner, that was really hard. And
Mhm.
needless to say, that was year one and two. And then as you go through vet school and you get into like final year, and you're like, all right, this is just the extent of my orthopedic assessment. How do I feel for patella luxations and cruciate ruptures? And that's pretty much it. We don't even think about soft tissue. So that in itself is like an entire podcast. And I'm sure you've interviewed other people regarding that. So yeah, so that's where I think my love for anatomy came from because it was so relevant to being a, a good clinician, a good rehabilitation practitioner, knowing when is it pain in like the joints, when is it pain or stiffness within the fascia, the connective tissue, and to be able to distinguish between that and have an appreciation for that and coming up with a treatment plan that addresses the right thing, you need to be able to know your anatomy. Yeah, I guess that's a
Yeah,
little bit of a background.
I love it. So, hi to everyone who's joined us. It's so good to have you with us. Marketa, hi from Dubai. That's pretty awesome, actually. Natalia from the Netherlands. It's great to have you. And Daniel Brown from New Zealand. Welcome. Sandra from Australia. Wow, guys. I think we hit the Australia New Zealand time zone here. This is amazing. What time is it? I never
I
have you guys
reckon it would have.
because it's always the wrong time. So I'm really happy to have some Australians and New Zealanders here. Awesome, guys. Okay, so Priya, can you define for us, we talk about anatomy and then we talk about applied anatomy. What does applied anatomy mean to you? Oh my goodness, more from Sydney. It's 9 p.m. Welcome, guys.
I think this time zone works because like I'm in Singapore time zone and it's only I think about 2 to 3 hours to Australia, New Zealand. So yay!
Nice. I love it. Okay,
Yes.
fantastic.
So applied anatomy, what is it, right? It is essentially the clinical application of the knowledge of anatomy. So what is it that I need to know about anatomy that's going to clinically enhance my skill as a rehabilitation practitioner or as a veterinarian or as a hydrotherapist, whatever field you may be in as a veterinary professional, paraprofessional, and uh, the course or like the subject is actually created to clinically enhance your knowledge and application.
Okay. Okay, I really like that. So very much taking that theoretical knowledge that is first year anatomy, which is highly overwhelming, and then bringing that into the space where we can apply it to our patients and what's in front of us. I like that. Thank you.
Yeah.
Okay, so in your experience, what are some of the most common missed connections between anatomical theory and that clinical application?
I feel that in theory we learn so many things about different muscle groups, right? It's like, okay, we have this muscle and this muscle does this function. Um, and let's say like the shoulder. The shoulder is like the most complicated part of a dog's body. And it's so closely associated with the neck and the skull. And we don't really talk about, okay, if there is pain in this area, how does it relate to how the dog is going to move its front leg? If the dog is limping in the front leg and you feel pain radiating down the limb, what are the potential differential diagnoses? So when we learn anatomy, like in vet school or other sort of like a very traditional um, practice, right? We're learning it in isolation to function when it shouldn't be taught that way. It should be taught from a perspective, okay, uh, the dog is presenting this way. What are the potential structures that could be causing the dog to move this way? Shortened stride lengths or reduction in extension. I think even up to the point where I was studying rehab, when I found, reduction in extension angle of like the shoulder or the hip, I just thought, oh yeah, the dog has a hip joint issue. Whereas now I know that if the dog doesn't want to extend its hip, yes, it could be the hip joint, but hey, hello, iliopsoas pain. Maybe that area is really tight and painful, so the dog doesn't really want to stretch out its hip. So, knowing this actually helps you kind of go, all right, let me check for psoas pain. Let me check for like tightness in its adductor muscles. And so I think that's where the gap is between your traditional theoretical learning from the textbook or from vet school versus like what we've created, which is like applied anatomy.
Okay, I really like that. Well, and as you were talking now, I was thinking about the adaptability as well of the body, in that, yes, we learn that a muscle has an origin, insertion, and a function, but so often when the body is compromised, if we're dealing, for example, with an amputation or a chronic injury, or there's some change to the body, how do those structures, how do those muscles adapt to take over the function of the damaged tissue? Because it does, and they do. And I think that is really interesting. So I love the, going into the neurology as well, which again, it's just a
Yeah.
whole nother level of um overwhelming and very interesting things to talk about. But the body is just incredible. I love it. Priya, you've mentioned a few times that you've created something. Can you tell us what you've created so that we're all on the same page?
Yes. So what I created, let me just explain the intention behind the creation, right? So the intention in terms of creating this applied anatomy course was to simplify learning anatomy for people who not necessarily have had like a veterinary background training, like gone through vet school. Because I do realize and recognize that many of the professionals in our field of rehabilitation and hydrotherapy, canine massage therapists, they may not be veterinarians themselves. So they may not have had trainings where, yeah, we're going through musculoskeletal anatomy in a very old fashioned way, but also for vets like me who did not remember anything past second year anatomy, to be able to have like a refresher course in a way that you feel empowered to kind of step into that consult room and know what you're checking and what you're finding from your clinical assessment. So the course essentially is an anatomy course, and what you will learn from it, or what would a person learn from it would be, yes, we're going through the bone structures, the muscles and tendons, but hey, if I find pain in this area, what does that mean? Or if I find restriction in joint range of motion, what other structures should I be looking for? What other, soft tissue pathology may be there that could translate to this clinical finding? So that's what the course is about. And it's broken down to 3 segments where we go through the front leg, so going through shoulder joint, elbow joint, and the distal antebrachium. The second segment is the spine, so talking about the neck, thoracic spine, lumbar spine. And then the third segment is about the hind limbs. And so we have videos demonstrating these muscle structures, demonstrating trigger points that are in the common muscles, that we can palpate, and also short videos on how I do the clinical assessments of these areas. So it's very comprehensive, and I think it's very relevant for anyone who wants to um, upskill their knowledge on anatomy and kind of get an idea on how should I check for pain and dysfunction in these particular parts of the body.
Mm. Okay, I'm gonna share that link with you guys to the course um in the comments, so you should all see that pop up now. I think that is so important, Priya. I'm really glad that you created that, because truly, as a professional, like, first year anatomy is very hectic and very overwhelming, and I don't remember things that I don't think are important or like clinically connected. So remembering, and this sounds very counterintuitive, but memorizing and remembering all of the little details of anatomy, I just didn't. It was just too much for me. So being able to come out as a professional and then say, "Hey, let me refresh my knowledge of anatomy," I think that's really amazing. So thank you so much for putting that together. Mm.
You're very welcome. And you know what? And like I feel that sometimes like we want to be able to remember everything, right? And we're like, oh, if I remember everything, I am going to be a great clinician. But the reality is we just have so much information to remember that you just can't, your brain just physically can't remember everything. So what is it that what is it that is important to remember? So I think that's what the course kind of focuses in on.
I love that. Thank you. So to those who have joined us, it's so good to have you. Hi. Please let us know where you're from. We have lots of people from Sydney and Australia. And Sydney is in Australia, and from New Zealand. So that's really cool. And from the Netherlands and Dubai. So welcome everyone. So good to have you. Kelly, I haven't said hi to you. So hi, it's so good to have you. All right, Priya, how can understanding the relationship between muscles, joints, fascia, how can understanding that really well help us make better treatment decisions? I think you've kind of already touched on that, but can we
Yeah.
go a bit deeper? Oh
Yes.
my gosh, from Hungary. Hi. That's so cool.
Yay. I love it. You have such an international audience. This is so
It's
cool.
amazing. And Alex and Kelly from the UK. So hi guys, it's so good to have you.
All right. So I think as a clinician, right, like I often get referred dogs with like hip osteoarthritis and causing weakness in the back leg. And on my clinical assessment, most of the time, the reason why the dogs can't get up and walk, it's not because of the hip osteoarthritis. Yes, of course, it has weak hips, weak joints, probably weak muscles. So the dog is struggling to get up. But what is limiting pain is maybe back pain, so the muscles in the back, they've been working and working and working so hard that they become so tight, so painful that the dog can't stand up anymore because it's just too painful to do that. And I think, knowing like the anatomy of the area, knowing how to check areas for pain, and knowing that like myofascial pain is a real thing. That is so important. Like, and that will be able to go kind of influence your treatment plan for this patient and go, all right, I know that the dog is very prone to getting, hypaxial muscle pain here, and these muscles, the paraspinal muscle pain here. And that is the area that's really very stiff and sore for the dog anymore at the moment. So instead of just lasering the joint or doing acupuncture for the joint, part of my rehab plan is going to be targeting the myofascial pain in the back. Or maybe this dog, what's limiting the dog's mobility is its shoulder muscles are so painful. It's got triceps trigger points, deltoid trigger points. Maybe it's got a biceps tendinopathy because here in Singapore, most of the dogs walk on tiled, like slippery surfaces. So it's very common that they try to get up with their front legs and they keep doing the swimming motion. And then they end up injuring the tendons and the ligaments in the medial aspect of the shoulder. And this then limits their mobility. So knowing that, all right, I know how to check for soft tissue pain, I know how to check for myofascial pain, I know where to feel, and that will kind of influence your care plan, and that would ultimately make a difference on how the dog recovers with your therapy plan. So I feel like knowing anatomy, knowing the structures, knowing the clinical application, um, in terms of okay, which muscles are going to be mostly affected. Triceps is a big thing. Like I didn't even get taught about triceps trigger point in school. Like in vet school. But I didn't know it's a thing. I didn't know it could limit mobility. So, yeah, I think this information is super super important because it will directly affect your patient's response to what you do.
Yeah. And anatomy is the foundation. It really drives our clinical reasoning in all the ways. So I think that was a great answer. Thank you, Priya. Renata's from Brazil. Guys, it's so good to have you all. My voice is going. I think I'm reaching the end here. I'm so sorry. Okay, Priya, what advice do you have for vetrehabbers who want to improve their palpation skills, but also that visualization of what is under their hands that you spoke about in the beginning?
I
How
feel
would you
like,
do that?
well, all right. What I did, okay, this is what I did, right? And this is how I learned. Um, but I feel like a lot of people can relate to this because the more I speak to people, they're like having the same issues. So I I was learning from textbooks. So when I was doing rehab, that's when I relearned entire anatomy, right? So I was learning from textbooks, and I went through like, all right, muscles, tendons, ligaments of the forelimb. Where do they insert? Where do they end? Because from my clinical assessment, so when I was actively doing cases, I was like, oh, okay, this dog has like limitation in shoulder extension, but I don't know if it's joints, what other structures could limit the shoulder extension. And so I went back to anatomy books and tried to kind of learn about the structures in that area. What was I feeling? So it was a little bit of like going back and forth between textbooks and then what I was feeling in the body when I was checking the dog. Palpation skills came along kind of from attending CCRP. I found CCRP and learning from um, the the lecturers and the tutors that are there. I learned from Dr. Daryl Millis. I learned from Dr. Barbara Bockstaller, Marian Muka. Like I learned so much from these people, and I took away that knowledge, and went back and like was just practicing a lot of palpation, a lot of palpation. So like I actually volunteered at a shelter just so that I could see a lot of cases, feel a lot of dogs' bodies, and referring back to textbook and doing clinical things is how I learn best. At that time, I didn't really have like a resource which was very clinical. I know, Anne, you have created a very lovely like book as well on anatomy. I wish I had that, but it was not available then. I only had Miller's Guide to Anatomy, I think, and then the rehab textbook. So that's all I could work with. And so, yeah, I used textbook resources. I used a lot of clinical cases, like seeing a lot of cases, and then going back and finding information. That's how I learned. And I think that would be how someone could be good at anatomy and palpation. You just have to keep practicing. You just have to keep feeling and understanding what is it that you are feeling. So when you reach the end of a range of motion, what does that feel like? Does it feel like a hard stop? Or does it feel like a tug, like something's like resisting you pulling the dog's limb? Or is it pain? Is it just the dog like guarding the muscle because it's in pain? So learning to read the subtle signs and paying attention to when you check and how the body is responding is a really good way to learn.
Thank you for that, Priya. Your audio dropped from my side there at the end, so I'm not sure what happened.
Oh
Um,
no.
it's
Can you
I
hear
can
me?
still hear you, but it was just very soft. Just speak again.
Uh, is it clearer now? Because I think my Bluetooth speaker gave way.
There we go. That's the same volume now.
Oh, yay. All right. Okay. I got rid of that.
Yeah, that sounds
I'm just
perfect
going
now. Thank you so much.
to. Okay, great. Is that good?
Okay. Yeah, that sounds good.
Yeah.
Thank you.
Okay. Yeah.
Okay. Yeah. So let me tell you about what I created, guys, so that you're also aware of that. I am redoing my veterinary physiotherapy degree at the moment, which is super fun. But basically, last year I retook first year anatomy. And like you say, Miller's Anatomy is basically what we have in terms of a canine anatomy book. And it is an amazing textbook. Amazing, right? But for a first year student, that is so hectic. So trying to decipher origin, insertion, innovation, function out of all of the text in Miller's Anatomy is quite a job. And I found that most of the students were creating some form of chart or cheat sheet or something where they summarize it all together for themselves. And we also don't have images of the individual muscles. So I decided to fix that, and I illustrated all the individual muscles of the canine body, that not all of them, but all the ones that are relevant to us. And then I put that into a book that's called Canine Muscle Anatomy Simplified, because it summarizes it for you. It is the basics. It is the image of the muscle with the origin, innovation, function, origin, insertion, innovation, function, um, listed clearly next to each muscle. In terms of like how the body works, we know that the body doesn't work in isolation, like that one muscle at a time, but our brains learn best when we break it down one muscle at a time. So we created that, and I think it's a fantastic resource. Lots of people love it. So I'll share that link with you guys, and then you can have a look at that as well. And we're actually going to put together a little discounted offer between Priya's anatomy course and our anatomy book, so that you guys can benefit from both of those spaces, because they are complementing each other in a really great way, right? The anatomy book is the foundational knowledge, and then Priya's taking that into an applied space, which is fantastic. Kelly, yes, I just posted that link. So let me know if you guys don't have it, and then I can post it again. And I'll also come back on after our live and check that everyone has it. Okay. So, all right, Priya, do you have any favorite anatomical structures that you think often overlooked, but they actually play a really big role in movement dysfunction? You've already said the triceps, so you can't say that again.
No, yeah. I just gave away my favorite ones, the shoulder, neck. But no, okay. What's got me really interested lately has been the biomechanics of carpus, the wrist. I don't have to say wrist. I usually like speak to pet owners and I'm like, yes, the wrist. So I don't have to say that. Carpus and the tarsus. So the hock and the carpus. So what I learned, not recently, but at the CCRP course that I was tutoring in 2023, must be 2022, was that dogs actually need a huge range of motion in their carpus to be able to move properly. Like with all other joints, including the shoulder, hip, like you could lose quite a considerable amount of range of motion and the dog is still walk. But with the carpus, as soon as you lose like certain amount of range of motion, the dog's gonna have problems like stepping up things or, navigating obstacles. So I'm like, oh my God, carpus range of motion is really important. So I should focus a lot on doing passive range of motion, like teaching people how to properly do passive range of motions for the dog's wrists and ankles, to make sure that we try to limit the joint capsule from tightening too much. Even addressing like any sort of stiffness in like the muscles and the tendons around that area, So yeah, that's kind of like what is sparking my curiosity at the moment.
Oh my gosh, that's really interesting. If you're like, let's go into that a little bit more, because the carpus is often a joint where an arthrodesis is an option if there's, there are issues in other space, like whatever. Can you talk to us about a carpal arthrodesis and when that would be done, and should we not be considering them? I think they're usually last resort procedures.
Yes, and the last resort for a reason, Anne, because it really does significantly alter the dog's mobility. And I have a dog, like it's a toy poodle. She's still alive. Very unfortunate little dog, she's somehow broke her bones and it affected down to the joint, to the carpet. So she's got a carpal arthrodesis in the right forelimb. And then a couple of months later, broke her back leg. So on the contralateral limb, she also has a fracture repair. So she's like, this poor little thing is just, compensating so badly. She had really poor posture. She's very very curved in the spine because she's trying to take the weight off like both these legs. She had stiffness, like myofascial stiffness on the other two limbs. So I think like, carpal arthrodesis in most cases, when the surgeons decide to do it, they really need to do it, right? When the flexor tendon is like so significantly like affected, or if there's instability in the joint for whatever reason, or if the osteoarthritis is so severe that maybe they really just need to fuse the joint, clean up and fuse the joint, then maybe like that is like a decision that would help with improving the quality of life of the animal. But surgery is not the end for that animal. Like that animal really needs like an active rehabilitation program, the client to be educated as to like, hey, okay, so these are the compensation issues that are going to happen with your dog. These are the problems that they're going to face, because some people, I had this with a dog that had a cat that had a hock arthrodesis. When is my cat going to jump on top of the table? I'm like, think that is going to be possible with that leg because it's not going to be able to flex enough to get the load and the power to make that jump. So how about we break the height so that your cat can still go up the table and not have compensation issue in the other leg because the cat is a British short hair with hip dysplasia. So so these are the things that are really important to know, like what are the significance when a pet, cat or dog, loses range of motion in these joints, and how is it going to affect their mobility? Because if we kind of turn a blind eye and go, oh yeah, that pet's like solved, the surgeon's like, surgery is a success, yes. And then down the road, the cat's like, nah, I'm like aching in other parts of my body. So is it really a success? You know what I mean? So yeah, I think it's really important to know when is it okay to lose range of motion and how much range of motion can you lose before the animal starts really compensating. And when is it like, hey, we really need to pay attention to this because any loss of range of motion here is really going to affect the mobility in the long run.
How do you support your owners with dogs that have had something like that in terms of, are you teaching them how to spot compensation in their dogs, and are you teaching them ways that they can bring pain relief, or are you recommending that they are seeing you on a more regular maintenance basis? How do you make sure that these dogs have as long and happy and healthy lives as possible?
Yeah, so like our practice has kind of evolved over the years. So I've run this business for like 5 years now. And initially I was like, I got to do everything. And then I realized that, hey, I can't do everything. And for the the goal is always the pet to have the best pain-free, comfortable, functional mobility for the rest of its life. And the only way I can achieve that goal for my patient is if I start helping the pet owners understand what they need to do. So now we're very education based at the practice. And obviously, initially, there's a lot more like, okay, we work with the pet owners on a weekly basis. So this particular poodle that had that issue, it had a carpal arthrodesis and a repaired fracture in the contralateral hind limb. That dog didn't have very much pain, but if pain was present, we would teach the client how to do either a warm or cold compress, depending on the situation. And then I'm a big fan of lasers. It doesn't necessarily have to be a class 4 for home use. Like we advocate for class 3B lasers for home use, and they're really very effective. So we teach people how to use a class 3B laser at home for pain management in a safe and effective way. And then my practice is also focused a lot on exercise. I'm a huge believer of exercise, but not just like any exercise, the right kind of exercise, you know? And so currently we're like working with people and teaching them, all right, these are the exercise that we're doing. This is the program I want you to do. And then we check up on them like every month or every 6 weeks, depending. Some people need more guidance and they're happy to come like even as frequent as every 2 weeks. They're like, you know what? No, I know my dog enjoys these sessions. I know that I can see that my dog benefits from it. So now that poodle, which was the shape of a banana before, is like actually a long dog. So we were all surprised. We're like, oh my God, Sandy, you're really that long? Because she was always a little banana. And so when they can like clinically see the improvements, right? Then they're more keen on learning like, hey, okay, how do I maintain this? And especially when it comes to rehab exercise, everybody thinks that exercise has to be super crazy. Like, you know, oh, my dog has to like run this much and jump these hoops. And no, actually, like a lot of the gym-based exercise that focuses on, you know, neurocognitive training and proprioceptive training, you know, enhancing that pathway is really very important. That's where all of it starts. So I feel like education is what we do, what we focus on. We teach people how to help their dogs, and then we support that process, and that's what creates longevity with our client in terms of our client relationship, and also for the pet's mobility.
I love that. I think that is a really good way of approaching it, because like you said, you can't actually do everything. It's not sustainable for you or for the pet owner. So yeah, I like that. Thank you. All right, guys, if you have any questions, please let us know. Now is your moment. I do want to say that I've shared the links with you for Priya's program, which you'll see is on the VOL website. So VOL are actually our gold sponsors at this year's Vet Rehab Summit. And I can now officially tell you that our theme for this year's Vet Rehab Summit is dynamic by design. Why? Because we are made to move, and so are our dogs, and so are our horses. And so that is really what we're going to be focusing on at this year's summit, is that that dynamic design that is our patients. And it's going to be so good. It's going to be really, really good. We will have the website's going to be up probably in the next 2 to 3 weeks, and then we can reveal the whole lineup to you guys and all our lecturers. I'm very excited about it. But I do want you guys to save the date. It's on the 8th of November. It is going to be a fantastic event. We're making more ways available for you to join us if you are not an Online Pet Health member. So if you're not a member, please save the date. You are going to want to be there. Okay, Priya, thank you so much for your time today. It's been really awesome chatting to you.
Thank you so much, and it's been a pleasure. And I'm excited about the Pet Summit, 8th of November, to put that in.
Thank you. All right, guys, have a great day. Bye.